A new law expanding health care and benefits for veterans exposed to toxic chemicals. It took effect last week. This is a big step forward for the VA's medical system, and it shines a light on a backlog of problems that are overwhelmingly affecting women.
And especially in Texas, we were just talking about with Antonia, where there are some of the most restrictive abortion laws and the biggest population of women veterans in the U.S. NBC News reporter Julie Tsirkin heard personal stories from some of the nation's bravest women there. Take a listen.
You're a woman. I don't know what to do with you.
That's what Navy veteran Tana Plesher says a VA doctor told her when she sought care for a panic attack. And for the largest population of women veterans nationwide, Texas's abortion restrictions spotlight the existing gender disparities within the VA medical system, as some of them told Congresswoman Julia Brownley during a listening session on reproductive rights within the veteran community.
We spend our whole career assimilating into a male world. Why should we have to assimilate into male health care?
Before the birth of her daughter, Army veteran Amber Davila says she had multiple miscarriages, requiring several surgeries that may be illegal today. In 2016, Amber turned to the San Antonio VA for severe pain in her stomach and back. At that time, she says, the clinic had one gynecologist and a single ultrasound machine. Some clinics don't even have that. A 2020 Inspector General report found the biggest VA hospital in Texas went several years without a gynecologist and had inadequate women's facilities.
The service that I received was naproxen and toughen up.
This spring, the 37-year-old had enough. She paid out of pocket to see a regular doctor who immediately scheduled an emergency hysterectomy.
I suffered for 4 years with cyclical pain. I had no choice. The only treatment was to remove my uterus and my cervix. I had to have a full hysterectomy. So I have one child, and I don't have the opportunity to have other children.
Other veterans recounted similar experiences. The VA does not provide any abortion services, adding to growing concerns among military women.
NBC News was denied multiple requests for interviews by the VA, including access to their medical center here in Houston. Instead, they provided NBC with a statement saying approximately 300,000 women veterans of childbearing age rely on us for their health care, including services such as contraception, fertility care, and maternity care. And we will continue to make sure that they have timely access to the full suite of reproductive care.
Why is the VA not doing any women's health care for abortion? Why is that not happening?
Congresswoman Brownley is hearing from women demanding better medical infrastructure that is specific to their needs, especially in states where abortion is banned. Democratic lawmakers say the VA can expand services under existing law.
The Secretary has the authority to make that rule change. He could do it tomorrow if he wanted to.
Unlike the VA, the Department of Defense provides abortion services on military bases, where nearly 1 in 4 women say they were sexually harassed. But most don't report it, according to a study from the nonpartisan RAND Corporation. Lucy Delgadio says she was raped while serving in the military in the early 1990s.
My eldest is the product of my assault.
Lucy says she, not her abuser, was discharged after becoming pregnant, the military calling her unfit to serve. She lost her benefits, she says, experiencing homelessness while her mental health deteriorated, not only from military service, but from the assault, too.
We raised our right hand, so we should get the services that we rightly deserve. And that's all we expect. We want to get the services that our male counterparts get when they go to the VA.
Women are the fastest growing cohort in the veteran community, but there is worry among some of them that abortion regulations on top of existing healthcare issues among women will further impact recruitment.
This is fuel to the fire.
What do you want people to know about women veterans, especially with these restrictions in place?
We stood side by side, shoulder to shoulder. When we served, there wasn't a problem. I was the most visible service member, and now I'm the most invisible veteran. Why? Why is that?
An important question. Julie Tsirkin joins us now. Julie, thank you for that great reporting. Talk to us about the immediate steps. What's being done right now to address the concerns and the needs of these women veterans?
Yeah, Morgan and Vicki, these women told us their personal stories, and our team actually got exclusive access to join on some of these listening sessions. And Congresswoman Julia Brownley announcing this new effort to hear from veterans and see what can be done, especially for women. There's 300,000 of them throughout the country of childbearing age. So far, the VA not expanding service. I actually pressed them after their response in that statement, and they refused to answer on what exactly they're going to do. But this new sort of task force launched by the committee by Julia Brownley, they said in a statement yesterday that veterans are rightfully anxious and emotionally distressed about the future of their reproductive care. They're going to continue to press the secretary to see what can be done for these women.
Keep pushing for those answers. NBC News reporter Julie Tsirkin, we appreciate it. Thank you, Julie.
Great reporting, Julia.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.